Hello. You might have noticed that my office is looking a bit tidier than usual, and that's because I've had to step away with all the noise outside of our scaffolding being taken down. Hospice House is getting a bright new painted look for a bright new future, so it's all a bit noisy up there. So in my vlogs, I usually take a look back at what's been happening over the past few months, but really wanted to focus on some of the themes that we talked about at our Hospice UK National Conference in November. There's been a lot of buzz ever since and a lot of conversation, so I thought we'd focus on that today. Significant changes all around us. Death and dying has changed dramatically over the past 10 years. We know that people are ill for longer, that they've got multiple conditions and comorbidities all at the same time, and we know that the death rate is increasing. Cecily Saunders Institute told us at last year's national conference that by the year 2040, there'll be an extra 25% of people who will need palliative care. We all need to respond to this in different ways. This is the year that we celebrated the 100th anniversary of Cecily Saunders' birth. It's the 51st year of the modern hospice movement, and so many hospices have been celebrating major birthdays this year. Hospice care is dramatically different from the way it was 50 years ago and even 5 years ago. But I have to say, I do think Cecily Saunders would have been impressed. We often think about the hospice building, don't we? And people think of hospices as places that we go to die. But last year, 83% of hospice care happened again in people's own homes. And I was really pleased to see that bereavement support, which many people don't even associate with hospices, has increased and 49,000 families were helped last year. It's an amazing achievement. As we all know, these are challenging times for hospices. The dial isn't moving, so what's going on? In short, hospices are running to standstill. I can't believe the innovation that I see when I go round to different hospices and look at so many different ways of reaching more people and doing more with the same funding. Because to put it bluntly, although our income is rising slightly every year, our costs are rising much faster, and they just can't keep up. Hospice staff costs alone rose by 5% last year, and we know that the NHS pay rises aren't currently being matched for hospice staff. It's a really difficult situation. The one thing that we do know is that hospices can't afford to stand still. The do nothing option doesn't mean no change. Change is happening everywhere. To do nothing, not to change, means atrophy and irrelevance. Any kind of institution, and the hospice movement is now an institution after 50 or more years, has a choice to make: preservation, evolution, or revolution. As we've said, standing still, preservation isn't really an option for us, so we're left with the other two. Hospices are always asking me for the blueprint for the future. What should a new hospice look like? What would the hospice of the future be? Interestingly, I think we actually all know. We did an exercise in our Hospice UK roadshows this year where we looked at anonymised data from our PopNat tool. And we sat down and said, if this area had never had any kind of palliative care, what would we design? It was so interesting to see what people came up with. So many different ideas, but the vast majority of it out in the community. How can we go out to where people are? How can we use hubs? How can we work with other charities, use church halls, use retail units? It was absolutely fascinating to see. And when people did need beds, they were looking at care homes, they were looking at working with hospitals, they were looking at embedding new services in the infrastructure we already had. Nobody was building new hospices, which was so interesting. So we know where we would want to get to today, and we know what the stats are telling us about tomorrow. But it's very, very difficult when you've got the legitimacy of the public giving you funding and the NHS giving you funding to help all of the people that we're helping today. How do we change what we're doing without disadvantaging all the people that really, really need our help? And that's where the idea of evolution and revolution comes from. Put it bluntly, we need to start doing both. In terms of evolution, there are so many exciting things happening out there, and part of our role over the coming months will be to share those things. So, for example, could you look at a new retail unit on a high street where you get high footfall, and can Hospice at Home be there? Can you have outreach clinics there, as well as retail and coffee shops? Already good examples of other charities coming together to do this, and we'll be looking at what makes those things a success. Prince and Princess of Wales in Glasgow, for example, have looked at a new commercial model where they're helping young hairdressers and beauticians get into work and get their training, whilst also creating a service that local people want and helps bring them into the hospice movement. It's a really good way of reaching out to more people. We're also, again, looking at mergers and collaborations, and there's more discussion on that going on in hospices. But if you're not ready to think about merger, perhaps you might have a service that's under threat, you don't have enough funding for it. What might happen if you merge that service with your local hospice? So potentially hospice at home or wellbeing services. Might you be able to merge them and reach more people, even if they're not in financial trouble? These are some of the questions that we'll be asking over the next year, and I'm really excited to see as many hospices involved as possible. But at the same time, we need to be thinking about the future and the people that we're not reaching. Last year, we know that there was 118,000 people that we could have helped with traditional hospice care that we simply couldn't get to. And another 150,000 people died in hospital through frailty. We simply don't have the services or the funding to be able to help those people. So that's where radical change comes from. But we need to do that at the same time. We need to decouple it. There won't be many people in the hospice movement initially with the time or the space to get involved in this. But those who can will be working with other organisations and other ideas and looking at what's happening in other countries to think about new models, new ways of bringing in funding to the hospice movement and new ways that we can bring services to people. And we'll try them, and some of them will fail and some of them will succeed. But we'll be bringing them back into the hospice movement and enabling change in the long term. It's about that decoupling of evolution and revolution, but we're going to be doing them at the same time, and I think it's going to be really exciting. I must admit, when I was researching what I was going to say at conference this year, I was really nervous. What were people going to think? I couldn't stand up for a third year on a row and say how fantastic we were, and we are, but we're also not meeting some of the need out there, and I needed to be able to balance that. So I was so pleased when so many people have got in touch afterwards to say that we hit exactly the right note. And what this does is gives hospices the ability to make change and get involved in the way that works for them and their local community. I'm so pleased to hear that. If you want to go back and see more about the sessions at conference, then they're available on our YouTube channel. And of course, there are various e-hospice articles as well. You can go and take a look at that. But I just want to also say a huge thank you to everybody who was there at the conference and those who watched us on Facebook as well. I think it was a fantastic opportunity this year to share all of our learning, and we so enjoyed it. I'm convinced that hospices and hospice care will become ever more relevant in helping shape the way that society looks after people in the last phase of their life. I'm so excited and proud to be a part of it and feel privileged to be representing this sector. I just want to end by saying thank you so much for everything that you do every day. I really couldn't be more proud.